It is Tender Loving Research Day. We're showcasing and highlighting the great work that is done at the Ottawa Hospital. Their Tender Loving Research campaign is underway. It's a 3-year campaign. $50 million is the target, and the funds that will be raised will support cancer research, regenerative medicine, and research to improve patient care. This is groundbreaking work that's being done right here in our community. And we're joined now by Dr. Shawn Marshall, Medical Director of Traumatic Brain Injury Rehabilitation at the Ottawa Hospital. He leads a post-concussion research-based clinic. Good morning, Dr. Marshall.
Good morning.
And one of your patients is here, Jane Clark Foster. Good morning to you.
Good morning.
And we hear so much about concussions these days, but this is an area, brain injuries and concussions, where you've been working for a long time, even before it became a big topic and a big focus of attention in schools and in organized sports.
Yes, I think that we've known about concussions for many years. I think it's come to the fore through being recognized through sport. I guess our overlap with it is that dealing with moderate and severe brain injury, a number of the patients who over the years weren't getting completely better following concussion, since that's the normal expectation following concussion, are the patients that we're seeing. Now, these patients are definitely in the minority, and some call them the miserable minority, because greater than 85 to 90% of patients completely recover from concussion. It's this group with persisting symptoms that we've been focusing on to try and improve things for them.
So that's the post-concussion group? Is that how you would describe it?
That's the post-concussion. I think all of us expect that after having a concussion that we'll have symptoms, and I think that's the focus. We have to look at how it affects us and return to sport and return to work. And the expectation, like many injuries, is that of complete recovery. And we're focusing on those individuals whose symptoms are persisting to help them get back to the activities that they need to participate in.
So what kind of research are you doing? I know for one thing, you're actually gathering data, because that's the starting point, isn't it? Is to better understand the magnitude of the problem and what some of the different elements of it are.
That's exactly it. So this population, for instance, they're walking, they're talking. It's just difficult for them to do the higher level activities that they need to do often. For instance, return to work, be able to function in the day-to-day activities that they can do. I think a number of them often went unrecognized. Even professional athletes who had these types of problems wouldn't really acknowledge them. People didn't recognize or know what to do with them. And what we're trying to do is collect data. We're working with other centers throughout the province in a novel initiative to create a common group of data elements, data sets, describe this population, which hasn't been done before.
All right, so Jane, let's share your story. And I'm going to point out the fact that just happens that our question today is about trains blowing their whistles when traveling through a detour at Greenbank Road, and how there are residents in Barrhaven who are finding this very disturbing and disruptive. And you are very sensitive to sound.
Yes.
You told us when you came in here this morning that you were sensitive to sound, and while we were getting ready for the interview, there was lots going on here, and you were concerned that it would make it difficult for you to be able to talk on the air.
Yes, that's right. So for a via train sound, that would be very, very challenging. It would provoke a lot of symptoms, and it just living with the auditory issues makes it very challenging to go into any public place where there's a lot of noise. And it is one of those symptoms that really lingers and has gone on for, I was injured 2.5 years ago, and that is a persisting symptom that's very difficult to treat. So
was it a concussion that you suffered 2.5 years ago?
Yes, I slipped and fell on ice.
Okay. And initially, did you hope that obviously you hope you would just recover from that and move on? When did you start to realize that you had persistent issues associated with that?
Well, that is one of the challenges. You just expect that you're going to get better, and a number of symptoms do resolve. But there is I was just so happy to come to the rehab center because there's a really sophisticated expertise. And when I saw Dr. Marshall, he was the first person that gave me a prognosis and the first person to give me positive recommendations to treat specific symptoms other than just resting and waiting and seeing.
So tell me more about the care that you've been receiving and how it's impacted your life.
Well, in my experience, Dr. Marshall looks at all of the different symptoms, and he gives you recommendations to improve the functional functional outcome. So I was recommended to go to see a neurooptometrist, and I had vision therapy for a year, and that really improved my tolerance to movement, like being able to watch TV and being in the car with windshield wipers, just all of those small things that made a huge functional impact in everyday life.
Tim Kluk, who is the CEO of the Ottawa Hospital Foundation, the organization that's leading this fundraising effort. Again, this is an example of patients being able to access the medical experts who are at the front end of the research that's being done in an area.
Absolutely, and it's certainly a focus at the Ottawa Hospital is integrating research right into the clinics. And as you see here, there's patients having new treatment protocols that are informed by research, and the research that Dr. Marshall's doing, looking at best practice and findings elsewhere. And those findings come right back to Ottawa to get implemented in the clinic.
Once again, if you want more information about the research that's being done at the Ottawa Hospital, the impact that it's having on patients, how important this is to our community for local patients to have access to this cutting-edge care and research, go to tenderlovingresearch.ca. You can support this care and this research that's happening right here in our